Hello and welcome to an introduction to first aid. First thing we're going to look at is the principles of first aid. We call these the 3 Ps, quite easy to remember. The first one, the most important one, is that we try to preserve life. Make it a situation where somebody's had a heart attack, and our role as a first aider is to do the best we can for them and try to preserve their life. Second one, the second P, is we need to prevent the situation worsening. So you might have a cut on somebody's arm, we need to try and prevent infection, and that in itself prevents the situation worsening. The third one, once we've done that, is we need to promote recovery. So in the situation where you have a cut on somebody's arm, dress the wound. In itself, that prevents the situation worsening, but it also starts to promote recovery because it helps the blood to clot and seal the wound. Okay. Once you're qualified as a first aider in the workplace, you have various roles and responsibility. Your first role, or your main role, is you must give help to a sick or injured person until full medical treatment is available. You do your bit and pass it on to the medical professionals at a later date. Okay, that's your role. Responsibilities, you've got several. Firstly, you must attend and deal with any first aid incident, and that will involve assessing the situation, dealing with the incident, and treating the casualties accordingly. Basically, you have a duty of care and you can't run away. It's your responsibility in the workplace. Okay, secondly, you must gain a casualty's consent before performing any treatment of them. It may sound daft, but if you touch a casualty without their permission, then it could be classed as assault. So get permission whenever you can. If your casualty is unconscious, then the law allows you to assume that you have that consent and you go ahead and start your treatment. Okay, next one. You must minimise the risk of infection. You may find yourself dealing with cuts, blood, bodily fluids. You must try to prevent cross-infection both between yourself to the casualty and casualty to yourself. Next one. You're responsible for the first aid kit. We'll look at the first aid kit later. But that box in your workplace becomes your responsibility once you're qualified as the workplace first aider. You must inform next of kin if necessary. You may find yourself dealing with a serious incident where somebody's very badly injured. It becomes your responsibility to pass that information on to any relevant next of kin. Okay, after any incident that you deal with, you must complete an accident report form. This documents the incident that you've dealt with, and it must be completed as soon as possible after the incident's finished. Okay, we mentioned minimising cross-infection. Several things you can do. Firstly, always wear disposable gloves. Rubber gloves, nitrile gloves. Use them if you've got them. Next one. We mentioned cross-infection again. Cover any cuts that you may have. If you have a cut on your arm or your hand when you're treating the casualty, any infection that you may have may be transferred to the casualty because of that cut. Only use sterile, undamaged and in-date dressings. We mentioned the first aid kit. That is your priority within that first aid kit to ensure that they are sterile, undamaged and in date. Okay, next one. Once you've dealt with an incident, make sure you dispose of any contaminated waste properly and safely. Use yellow clinical bags if possible. If you don't have them, and not many workplaces do, but if you don't, double bag in bin liners and then put any waste into the normal waste, never into recycling bins. The final one, clean up after any incident. Usually pretty simple, but you may have a serious bleed involved in your incident, and therefore you may need to use professional cleaning companies to make sure that area is fully cleaned. Okay, let's look at the first aid kit then. First thing, you can see on the PowerPoint there, the workplace first aid kit must be green with a white cross on it. You may go into Boots or other retailers and you'll see various domestic first aid kits. They're not suitable because they're not green and they're not white. They don't have a white cross on them. The reason for this is that anybody within the workplace needs to be able to identify very quickly and very easily where the first aid kit is. Okay. Secondly, you must ensure that the first aid kit contents are sterile, undamaged and in date. You may not be aware, but bandages and the like have sell-by dates or use-by dates on them, and you must ensure that those are all in date. If they're not, they need to be disposed of and you need to buy new ones. Okay. No medication at all is allowed in your first aid kit. The reason for this is that we are first aiders, we're not doctors or medical professionals, and we aren't allowed to prescribe any medication whatsoever. Things like creams, ointments, certain tablets, anything like that, they're classed as medication and you must not have them in your first aid kit. Okay, as a first aider, you need to be aware of certain key legislations. Don't get too hung up about these, you just need to be aware of them. You can look online if you want to know more details. But let's quickly look at the dates. The four that you're interested in are the Health and Safety at Work Act, which is 1974. RIDO, which stands for Reporting of Injuries, Diseases and Dangerous Occurrences Regulations. It's been recently revised, or fairly recently revised, and it's now 2013. Health and Safety First Aid Regulations, which is a key one to the first aider, 1981. And the more recent one, General Data Protection Regulations. This involves any recorded documents such as your accident report form, and the relevant year for that is 2018. Okay, that's the introduction over. Thanks for listening.